If you feel a dull, aching pain around or behind your kneecap, especially when you go downstairs, squat, or stand up after sitting through a long movie, you might be dealing with what we casually call runner's knee. The medical name is patellofemoral pain syndrome. And here's the surprising part. You don't have to be a runner to get it. It's one of the most common knee complaints I see in teenagers, weekend hikers, and people who simply sit a lot. The pain is often vague and hard to point to, sometimes described as being deep inside the joint. The good news is that most cases settle down with the right approach. In this video, I'll walk you through what's happening inside your knee, why it hurts, to understand runner's knee. Picture your kneecap, the patella, sitting in a shallow groove at the end of your thigh bone. Every time you bend and straighten your knee, the kneecap is supposed to glide smoothly up and down that groove like a train on its track. The powerful quadriceps muscles on the front of your thigh pull on the kneecap, and your hip muscles help control how your whole leg lines up underneath you. When the kneecap doesn't track quite right, or when the joint surface takes more repeated load than it can comfortably handle, the tissue gets irritated and you feel pain. Things like weak or fatigued hip and thigh muscles, a sudden jump in training, lots of The classic pattern is a dull ache around or behind the kneecap that worsens with activities that load a bent knee. Stairs are a big one, especially going down, along with squatting, kneeling, running, and hills. There's even a nickname for the discomfort that creeps in after sitting for a long stretch with the knee bent, sometimes called the theater sign. Some people notice grinding or a gritty sensation, or a feeling that the knee might give way, though true locking is less typical. In most cases, a clinician can diagnose patellofemoral pain from your history and a focused physical exam, checking how your kneecap moves, your muscle strength, and your leg alignment. Scans like X-ray or MRI usually aren't needed at first, and are reserved for unclear cases, a significant injury, or symptoms that don't. Here's the reassuring part. The large majority of runners' knee cases get better without surgery. The first goal is to calm things down by managing load, not stopping all activity, but easing back on the movements that spike the pain, like deep squats, long stair sessions, or a recent jump in running mileage. Swapping in lower impact options for a while, such as cycling or swimming, lets you stay active while the knee settles. Many people find that gentle, pain-guided movement beats total rest. Ice after activity and short-term over-the-counter pain relievers can help with flare-ups, though you should check with a pharmacist or your own doctor about what's appropriate for you. Since I can't give you a personal dose here, some people benefit from supportive footwear or insulation. Once the sharp pain settles, targeted strengthening is often the key to lasting recovery, and the evidence points strongly toward working the hips, not just the knee. Strong hip muscles, especially the ones on the side of your hip that control your thigh and keep your knee from caving inward, help the kneecap track better. Classic, gentle starting moves include side-lying leg raises, clamshells, bridges, and controlled squats kept to a comfortable, pain-free depth. Strengthening the quadriceps matters too, and a physical therapist can guide how deep and how heavy to go so you don't overload the joint. The rule of thumb is that mild discomfort is okay, but sharp or worsening pain means ease off. To prevent flare-ups, build training up gradually, avoid sudden mileage. So when should you stop self-managing and get evaluated? See a clinician if the pain follows a sudden injury or a twist, if your knee swells quickly, locks, catches, or gives way, or if it looks red, hot, or you have a fever along with it. Also seek care if the pain is severe, keeps waking you at night, or simply isn't improving after several weeks of sensible self-care. those features can signal something other than ordinary patellofemoral pain that deserves a closer look. To recap, runner's knee is pain around or behind the kneecap, usually driven by load and tracking rather than serious damage. It's very common even in non-runners, and most cases improve with activity modification and gradual hip and thigh strengthening.